was having more and more difficulty seeing clearly, especially street signs. You have no idea how many U-turns I could make before I got to my destination if I was in an area that was unfamiliar. So I consulted with Dr. Salib, and he performed cataract surgery on both eyes. As you can see, I'm not wearing glasses, and I get to my destinations in a very short time.
We are located in the Saddleback Memorial Medical Towers. See well, live well.
And welcome back. Dr. George Salib is here today with the Orange County Eye Institute, and he brought along a pamphlet, and we're going to talk about some of these things, eye care facts and myths. And I think it's pretty interesting. I looked over your questions, and I looked over this, and there are a lot of myths. I guess some people might call it old wives' tales or whatever it might be, whatever that term may be. But you grow up learning about these things, or hearing them. So let's go. You brought along six myths that we're going to talk about today. And the first one is reading in dim lights. And that's something that I remember hearing about as a kid. And we got a photo of, I don't know who that is, Galileo or Columbus or somebody there, reading by candlelight, which of course, for eons, that's how people read.
Yeah, exactly. This is actually called The Young Man Reading by Candlelight by Matteo Stone. And as you can see, yes, for centuries people have been reading by candlelight and in dim light because we didn't have electricity.
Right.
Now that we have great lighting, it's a lot easier to read. Now, of course, that basically is a myth. It does not harm your eyes to read in dim light. However, it does make it maybe a little more challenging because you have poor illumination, which leads to decreased contrast in your paper. So you can't see the print against the background. You see less visual details. It just makes it overall more difficult to see, especially for the 40 and over crowd, where people tend to lose their focusing ability. They don't have quite the focusing ability they did when they were younger than that. And that's normal, that as you get past the age of 40, your focusing ability decreases because the lens itself becomes a little less pliable, the lens that allows you to focus. So good lighting increases what we call your depth of focus, like the range that you can see things. So that's another challenge. So it makes it more difficult to read, but it doesn't harm your eyes in any way.
Okay, that makes perfect sense to me because I wear reading glasses, obviously, and if I'm out in bright sunlight, there are certain things I can now read without my reading glasses on. It's as simple as that. I still may need them certain times, but the better light is it makes it a little bit easier.
Yeah, certainly. You don't have to hold the paper quite as far.
Yeah, and what's actually nice, you know, I read a lot through the Kindle app or whatever, and of course, if you've ever seen those apps, you can have a white background with black text, black with white. There's like 4 or 5 variations that fit your needs the best, and it's kind of nice.
Yes.
Plus adjust the brightness on the screen. Well, let's look at the next one, and this one is, I need to wait until my cataract is ripe before it can be removed. I guess that means that it gets to a certain point.
Exactly, and that is also a myth. This is, as you can see, there's a cataract on our screen, and the cataract is basically the lens of the eye that gets cloudy with time. And as the lens gets cloudy, it prevents you from seeing well. Now, in the past, maybe 20 or 30 years ago, this used to be a true statement because we had to wait till the cataract was a certain density or a certain firmness in order to be able to remove it. Because they used to make a larger incision, they had to go inside and either freeze like a special tip called a cryoprobe onto the cataract to remove it, or else they would remove the whole lens in one piece through this large incision. But then again, cataract surgery back then was a lot more primitive than it is now.
Right.
You had to stay in the hospital for 3 days with sandbags around your head. They wouldn't put a lens in your eye.
Wow.
And you ended up with these big, thick glasses in order to be able to see. Versus nowadays, it's an outpatient procedure. It's about 98% successful and done usually within a span of about 15 minutes. And it's done through these micro incisions about 2 to 3 millimeters long. and you can break up the cataract even before it is ripe. In fact, you can take out a lens of an eye before it develops into a cataract. Now, in order for insurance to be able to cover part of your surgery or all of your surgery, it has to be a cataract that is visually significant, meaning it's dense enough that it's causing you to have problems, let's say, driving at night because of glare or trouble seeing the fine print. But a lot of people, even in their late 40s, early 50s and on, decide to take out the cataract or the lens of the eye before it turns into a cataract in order to take advantage of the newer lenses now that are available that allow you to see like far and near at the same time. So it's really changed quite a bit. So yes, it is a myth that you basically do not have to wait till the cataract is ripe.
All right, very interesting. The next one we've definitely heard over the years, and I think even more so now, everybody, we got a photo here on a computer, using a computer or watching TV too much or too close. That was, as a kid, we didn't have computers then, but the kid was 3 feet in front of the TV watching their cartoons, and sit back and get back, it's going to be bad for your eyes.
Yes, I've heard that many a time myself, and that is also a myth. It doesn't harm you to sit too close or too long in front of the TV. Now, of course, there are other health issues we might talk about. If you're sedentary and not moving around because you're watching TV too much, that can lead to obesity, which can lead to problems with the eyes later on. But there's no direct bad effect from just watching TV too long or using a computer for too long or sitting too close. Now, a lot of kids will sit closer to a TV because their focusing ability is so good that they can focus up close without any difficulty. However, if you see a child sitting close to a TV or computer all the time, then you have to take them to the ophthalmologist in order to determine if they need glasses. They might be nearsighted and they just can't express that to you. They might only be able to see up close, and with glasses they'll be able to see far away. But generally, it does not harm your eyes. A lot of people, after looking at a computer for a while or a TV, their eyes will feel gritty or tired, or even reading a book for a long time.
Right.
And that's because your blink rate decreases, meaning you blink less often when you concentrate on something. So it's important to maybe every 20 minutes just take a break, have your eyes look far away for about 20 seconds, or use an artificial tear to lubricate your eyes, and that'll take care of the problem. But yeah, it doesn't harm your eyes to watch TV or see a computer for too long.
All right, well, that we've heard about since I was a kid when it comes to TV. Here's another one that I would hear when I was a kid. Wearing eyeglasses will make you dependent on them, and as I said to the doctor before we got on, we all remember as kids, maybe a parent or an older sibling had their glasses, and you would put them on saying, oh, look, I'm wearing glasses, and your mom would go, don't do that, you're going to be dependent on those glasses.
Right, you'll need those glasses forever, and that's not true. All it is, it's when a person wears a pair of glasses and they've never worn one before, and if those glasses are fit for their eyes, it's like going from a regular TV to a high-definition TV. All of a sudden, you're seeing things you've never seen before. People's faces more clearly. Print is much more clear. So you want to wear the glasses just to have that clarity of vision.
Right.
But it doesn't make you dependent on them. And that's different than, let's say, a young child who actually needs glasses to avoid having a lazy eye or to make that lazy eye better. So some people really need those glasses in order to prevent that from being a permanent thing. So kids don't outgrow lazy eyes. You really have to give them the glasses in order to prevent that. And in adults, it doesn't make you dependent on glasses.
Okay, very good. Cataract surgery, and we talked about the cataract getting ripe, but here's another one. Cataract surgery can be done with a laser. Myth or fact?
And that's
and here's
true.
Your new machine.
Yes, this is a laser cataract surgery machine called the LensX laser. If you had asked me that question about 3 or 4 years ago, I would have said, yes, that is a myth.
Wow, really? That short a time ago?
Yes, it's quite near, quite recently that this has happened. And now with a video-guided precision, we can make laser-guided cuts in your eye, basically incisions that are tailor-made for your eyes and break up the cataract into smaller pieces, allowing us to use less time and energy to remove the cataract. I'm one of few surgeons in this whole area that are able to do this kind of surgery, and I was actually the first surgeon in the Western US to use the latest software version of this laser. It has really made this surgery even more precise and even better. It's really a wonderful
That's great.
addition. Yeah.
The advances are just tremendous. Okay, the final one that if you would have asked me before I read this, I would have said fact, eating carrots will improve my vision. Because we've always heard that.
Right, eat your
Or
carrots.
the beta carotene that's of course in the carrot.
Right, right. And I wish that were true, but it's actually a myth. Carrots are an important source of vitamin A, and beta carotene is the form of vitamin A in those carrots. Now, vitamin A is important in general because that beta carotene is something called carotenoids. It's a class of medications called carotenoids, which basically are antioxidants in your body, and they're found in higher concentrations in your eye. So if you eat carrots or if you eat things with beta carotene such as spinach, kale, collard greens, then you'll get more beta carotene. Now, that beta carotene has been shown in some studies to decrease the rate of advancement from dry macular degeneration to wet macular degeneration. So in that regard, it is helpful. However, it also could be harmful for people who are smokers who take extra amounts of beta carotene, because that's been shown to increase your chances of lung cancer.
Wow.
So you have to be careful in terms of what
Yeah.
you do and how much you do it, how much of something you'll take. Carrots are good for you, but they're not going to improve your vision.
Okay, all right. So, well, we'll still eat them, but we won't go all Bugs Bunny on the carrots like we used to, I guess.
Right.
But they are good for you, and they taste good. So I like this. This was a very fun segment. I hope we do this again.
Yes, thank you.
Yeah, this was a lot of fun. If you want to get hold of Dr. Salib, Orange County Eye Institute, there's the number on the screen, 380-EYES or 380-3937, ociinstitute.com. Nice to see you.
Nice to see you too.
All right,
Thank you.
take care. We'll be back in just a moment. This was a fun one. I like doing stuff like that.